Mental illness is a recognized medically diagnosable illness that results in the significant impairment of individuals' cognitive, affective, or relational abilities. 3 common misconceptions about mental illness therapy. I don't need therapy, I have friends and family. It is possible your friends and family are going to be full of opinions that are not helpful for you. I don't need therapy because I don't have serious problems. The longer people wait to start therapy, the worse the problem might get. Therapy is for crazy and weak people. It actually takes a lot of strength to face the problem and ask for help. Anti-anxiety medication works solely to reduce the emotional and physical symptoms of anxiety. These medications work quickly and very effective in the short term. However, people prone to substance abuse may become dependent on them. Mood stabilizers commonly treat the mood swings associated with bipolar disorder. The oldest of them, lithium, and has proven very effective, particularly for bipolar disorder type 1. Mood stabilizer can prevent manic or hypomanic episode and depressive episode. Some medication can be prescribed off-label, which means they haven't been approved by the FDA for a given condition. Antipsychotic work by blocking the effective of dopamine, which help reduce the psychotic symptoms like hallucinations, delusion, and disordered thinking. Antidepressants work by affecting the chemicals in the brain that are associated with emotion, including serotonin, norepinephrine, and dopamine. Psychotropic medication can turn the volume down for those with paralyzing anxiety. It can also provide a kickstart for those unable to get out of the bed in the morning and lost motivation due to depression. Also, those who suffer from severe mental illness, medication can help to stabilize the symptoms. It's okay if you didn't feel better straight away. Some medication can take a few weeks to work because everyone responds to drug differently.
ECT. ECT is a medical treatment most commonly used in patients with major depression or bipolar disorder that has not responded to other treatment. It is a brief electrical stimulation of the brain performed while the patient is sedated, and it involves sending an electrical current through your brain, causing a brief surge of electrical activity within your brain. ECT can help people return to their normal productive lives, and it is the fastest to treat severe mental health disorder, while medication and other treatment can take weeks. TMS, Transcranial Magnetic Stimulation, is a therapeutic non-invasive procedure that uses magnetic fields to affect and stimulate nerve cells in a specific area of the brain that are responsible for mood control. When pulses administered in rapid succession, it is referred to as a repetitive TMS, which can produce longer-lasting changes in brain activity. This procedure is painless, safe, and well-tolerated and does not require sedation unlike ECT. This procedure is used for depression patients to improve symptoms when no other treatment is effective. Behavioral therapy is a term that describes a broad range of techniques used to change maladaptive behavior. The goal is to reinforce desirable behavior and eliminate unwanted one. Cognitive behavioral therapy. Behavioral therapy is related to cognitive therapy, sometimes a combination of the two, known as a cognitive behavioral therapy, that helps patients understand the thoughts and feelings that influence behaviors. Cognitive therapy helps people identify distortion in thinking and understand how these distortions lead to problems in their lives. Interpersonal therapy is a short-term approach to treat mood disorder. The main goal is to improve the quality of the patient's interpersonal relationships and social functioning to help reduce their distress. Psychodynamic therapy. It is based on the idea that talking to a professional about problems people are facing can help them find relief and reach solutions. It's also helped them to better understand their thoughts, feelings, and conflicts that contribute to their behaviors, and to understand some of the unconscious motivations that sometimes influence how people think, feel, and act. Supportive psychotherapy. It's a form of talk therapy where a patient will be encouraged to vent. A therapist will listen to what the patient has to say and then can offer some important advice on how to deal with the situation. The idea is to provide emotional support for patients who are going through a tough time.